Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. And welcome to this week's show. My guest today is Dr. Margaret Bordeaux, a pediatrician at SMHC Pediatrics, and our topic today is childhood vaccinations. Welcome, Dr. Bordeaux.
Thank you.
First of all, Dr. Bordeaux, we'd like to know a little bit about you. Why did you choose medicine as your profession?
So I grew up in a household where my parents were both teachers. My dad taught biology and chemistry, and my mom was a school nurse teacher. So I came from a background where science was important, which I think for all young women growing up in this day and age is really important to have that support. And then I was a pretty decent student in school, so it kind of piqued my interest to care for others, and I enjoyed working with children a lot of the time. Again, my parents being both teachers, we spent a lot of time with other families and in the schools and doing school activities. So that caring and that background and that science kind of headed me down the road into medicine, and found like that was the best way to care for others.
And was there any one person from your childhood, maybe an aunt or an uncle, who was a physician that inspired you to do this?
I did have good physicians when I was younger, and I do remember them, but I don't necessarily think that there was one event or that said, this is the right thing to do. I had definitely was one of those children for a while that wanted to be, had the flavor of the week in terms of professions. But then when I got into high school, I really started to spend more time in the hospital. I had an interest in medicine, and I started to spend more time in the hospital. I had a very good friend in high school whose mother was a pediatrician, and she certainly influenced me in a positive manner. She had taken care of me when I was a young child for a while too, but I think kind of things built on one another, and kind of the way that I saw the world and I saw the needs in the world, medicine became the best way for me to serve those needs.
Now, there are many paths you can take when you go to medical school. Why pediatrics?
Why would anybody want to do anything else is my question. Every day you get to go into the office and you see these bright smiling faces and they make you laugh, and you can be silly and you can wear bright colors, and really you're there for the support of the families, which is one of the best things about pediatrics, is helping the parents make good decisions about their children and helping their children grow. Pediatrics is a lot of hand-holding and advice and consoling and laughter. So those are kind of the really nice pieces of pediatrics, and I find that there's less burden, I think, sometimes in the pediatric visits. So for instance, in adult medicine these days, my husband's a family practice physician, and he really gets emotionally weighed down by a lot of the drug-seeking patients in his community, and that it's just you want to help those patients, but it just takes a lot out of you to take care of them. And I think in pediatrics, even the more difficult patients are interspersed with so much fun and such healthy young people that are really vibrant. And I absolutely love the fact that I get to watch them change from this tiny, tiny infant into a teenager. It's really one of the best parts of being in practice. So I really couldn't imagine doing anything else. And I think for some people who say, oh, you're a pediatrician, and they say, oh my goodness, I could never do that. And they think of sick children and ill children and taking care of children with disease or bad disease. And two different things on that side. I think one is that those children are few and far between. So yes, children do get sick, but the really great thing about kids is that they get better. Even with childhood cancers, there's something like an 85 to 90% recovery rate with certain types of cancers.
Tell us a little bit about being a pediatrician and how it's different from being a general practitioner. At what age do the children age out and you refer them to other doctors?
In general, pediatricians take care of children from 0 till they're usually done with high school. We will keep patients in our practice through college a lot of times, and one of the reasons is because we feel like people who go off to college in general are pretty healthy young people. They have a health center on campus, so they can get any acute care needs taken care there. But also that after 4 years, they may not come back to our community here. They may move off and settle in the community where they're going to school, or they may choose a completely different community to live in. So to say, okay, when you're 18 or 19, choose a new physician for 4 years and then go ahead and choose another new physician doesn't make a whole lot of sense to us. So we try to keep those children in our practice if they care to be. Sometimes at 18, they're like, I don't think I want to sit next to the crying toddler in the waiting room anymore, and they decide to go off to another practice on their own, which is fine. So we have that conversation. But in pediatrics in general, we are trained to deal with the problems from 0 to 18 years old, whereas a family practice doctor is taught to deal with problems from 0 to 118 years old. So they have a lot more on their plate. And often, as I mentioned before, since my husband's a family practice doctor, he often says he knows a little about a lot. So, and pediatricians, I think somewhat you can say the same thing, but ours is we can know a little bit more about a lot. So that's kind of the difference between those two specialties, is because both things kind of really take a lot of knowledge, and there can be a lot of different things going on.
Well, we're here today to talk about childhood vaccinations, and it's a hot button topic in our society in general. I'm sure you have a lot of concerns, and parents have concerns. There's a lot of information and misinformation out there. Why don't you share with us some of your feelings about the subject of childhood vaccinations?
Right. So we try to address with parents what vaccines the child is getting at each visit. So in general, that actually starts when the infant is still in the hospital, because we offer the hepatitis B vaccine in the hospital, because historically, basically, if you vaccinate a child within the first 24 hours for hepatitis B, you have much better chance of avoiding the disease if there was any chance that the mother had the disease while she was pregnant and for some reason it didn't get caught. So that's one of the reasons why we start that vaccine so early. So it actually all even starts in the hospital. And then over the first year of life, children really get several different vaccines throughout pretty much every visit that they come to the pediatrician. I often joke with parents when they first come into my office for their newborn visit, because generally if they've gotten their hepatitis B vaccine in the hospital, they don't need anything that first visit when they see me. So I joke with them that this is pretty much the only visit they'll come in that they won't get a vaccine. And so that kind of starts off the conversation a little bit and starts to give me a sense. And usually at that point in time, parents will somewhat bring up, if they start to have any concerns, and say, something to the effect of, yeah, we're considering not doing certain vaccines, or, can we talk a little bit more about that? Or our feelings are X, Y, and Z about vaccines. I would say, here in the Biddeford community, we haven't seen too much vaccine declination or avoidance. I think we all do have people in our practice who have been declining vaccines more than we would like to see it happen. And so our job in the American Academy of Pediatrics really, really encourages pediatricians to have discussions about vaccines with families each time they come into the office, no matter if they've decided to do vaccines, if they've decided to do certain vaccines, if they've decided to do a different schedule. So that we've been starting to see. I don't know if I would necessarily say it's a trend. For me in my practice, it seems to be a little bit sporadic. I have a few families in my practice who are very steadfast that they're not going to vaccinate their children. But more frequently, what I do see is that parents have concerns about their children. And one of the concerns that they have about their children is vaccines. And so we just try to have a conversation. I try to educate them about the importance of vaccines, about why we vaccinate, about how much that we're going to vaccinate. And I think the really important thing with all decision-making for parents is to try to let them know that this is a conversation that we're going to keep having, the same way that I talk about obesity and what healthy choices are for children, or to not drink very much juice, or all of those different types of things that I advise. Vaccines are just another healthy choice that I advise parents on. So that's kind of how I see it, but it certainly becomes more difficult when parents maybe feel like they're being judged per se for not vaccinating their child, or what that conversation looks like between the provider and the parent.
So what would be the best argument for vaccinations?
So I think vaccines, over time, we've seen that they work. So that's the best argument for them. We've almost eradicated polio in the whole world just about, and the pockets in the world where they still do have polio are places where they have increased vaccination fear and declinations. So I think that is probably the best argument. And I think we don't see a lot of these diseases on our doorstep anymore. We don't see cases of polio. We very rarely see cases of measles. We don't even really see chickenpox very much anymore. And so these diseases and their outcomes and their morbidity is fading from people's minds.
And so I guess the next logical question is, what are the arguments you're hearing against vaccinations?
I don't think that there are any scientifically based, evidence-based arguments against vaccines. There's no supported arguments by the CDC or the American Academy of Pediatrics that vaccines are really unsafe in any way. Like any medication, there's always a chance of an allergic reaction. And I would say that's probably the biggest reaction that I see from children getting vaccines. It doesn't happen very often, but if anything were going to happen, that would be the thing that I would say parents, if anything, should be concerned about, and it's something that we usually try to talk about when parents come in for vaccines. But in general, I think there's a lot of information out there, and as people I'm sure have already heard, back in the late 90s, a study came out in the Lancet, the British Medical Journal, about a link between the measles, mumps, rubella vaccine and autism. Later, several years later, that study was completely disproven, and it was found that the man who wrote the study had falsified all of his evidence. There was absolutely no link. There have been hundreds of millions of dollars spent studying any links between any vaccines and autism multiple times since that time, and none of them have come up with a link between any vaccines and autism. So unfortunately, though, that study, I think, was one of the things that piqued interest in parents and started to say, maybe you should be questioning what is in vaccines. So I think that's somewhere we saw a bigger surge in declining vaccines. There are other multiple things. I think there was the thimerosal debate also back in the mid-90s or so. Thimerosal is a mercury component that had been in certain vaccines a long time ago, and the debate came up in association with cavities. And they had some mercury in fillings and cavities, and was that a good thing? And there's mercury in some of food sources, and so what is this mercury doing? Is that a good thing to have in our bodies? Is that not a good thing? And all of the studies that were done, nothing ever came up that this level of mercury is harmful or this type of mercury is harmful, because it's actually a different type of mercury that was in vaccines as opposed to that was in fillings in people's teeth. But it just sparked debate, and it sparked discussion for families. And so what families started to say was, okay, well, what else is in vaccines? Or let me ask about this, because this seems like something that's not good that's in vaccines that I don't want to put in my child. And now there's no thimerosal in any of the vaccines that we give to children. There is still thimerosal in the adult type flu vaccine as a stabilizing agent. But again, nothing ever came out. There was never any study that said that this mercury is harmful in any way. It just was people saying, well, that seems like maybe not a good thing to have in our body. So some parents also are concerned about the components that are in vaccines. That's another concern of theirs. The other thing I think is they feel like, again, if you're poking a child with needles, that just seems invasive and scary. And they have this, particularly for infants, they have this very small, delicate looking new package in their hands, and they feel like, I don't want to poke them. I don't want to cause pain. I don't want to cause harm. And that's very valid, and it's a very emotional experience to have your child vaccinated, to have them poked with a needle. And so I think that plays into it too, that emotional piece. And then I also think that there is a minority of people, but there is also some distrust of the pharmaceutical industry and what happens and why they're making vaccines. However, I can tell you that about 2 to 3% of the entire global pharmaceutical revenues come from vaccines. Really, pharmaceutical companies don't really make very much money on vaccines. Maybe the newer ones they make some money on, but really the ones that have been around, for instance, the polio vaccine, they're not making a lot of money on these vaccines. So, and they're not coming into the offices and promoting vaccines. We do a good enough job of that ourselves that it's not somebody pushing vaccines on people because of the revenue that is brought in by them.
You're listening to Southern Maine Healthcare's Medically Speaking with Robert Erickson. My guest today is Dr. Margaret Bordeaux, a pediatrician at SMHC Pediatrics. And we'll be right back with more of our show after this brief message.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back with our guest, Dr. Margaret Bordeaux, a pediatrician at SMHC Pediatrics. Now, for a young mother who maybe is going to be giving birth in a month or two, who's concerned about all the pros and cons that you just spoke about, who might not understand exactly what's going to happen, tell us a little bit about what they can expect in the first few months of the child's life.
Well, first, if they have a little bit more in-depth questions and they haven't had a chance to meet with their pediatrician first, I would say that they could review the American Academy of Pediatrics website. It's very nicely done for parents and talks a little bit about the schedule of vaccines and what's recommended at what ages so that they have that as an expectation. The other thing I would say for expectant mothers who are still pregnant is that meet your pediatrician. So go and talk to the physician who you are going to choose to take care of your child and ask that question. Ask that provider, what do you think about vaccines? What do you recommend? These are my thoughts on them. Is that something that goes along with your thoughts? I think that's helpful for families. It's certainly helpful for pediatricians to know and expect if this family decides to come to me, what am I going to recommend, or what is the conversation going to look like? So I think that's definitely the best thing I can recommend is talk and see what is out there. But Hep B is given in the hospital, and then in general, the second hepatitis B vaccine is given at about a month of life, and then at 2 months is when the more burdensome vaccine doses are given, meaning just that there are more vaccines given at 2 months. And one of the reasons that we wait to those 2 months is that there is a chance that infants will get a fever with these vaccines, and we are very, very, very careful about any thing that causes fever in the first 2 months of life, not because the fever is dangerous in any way, shape, or form. The fever is just a natural part of the body, but that fever could signify infection or disease that we need to know about. So we never want to miss that in the first 2 months of life. So one of the reasons that we wait on these other vaccines until infants are 2 months is to avoid any chance of fever. So at the 2-month visit, in general, the CDC recommends that children receive diphtheria, tetanus, pertussis, polio, Haemophilus influenza, pneumonia, and then rotavirus. And some of those can be given in combination vaccines. It depends on your physician's office. At Southern Maine Healthcare, though, all of those vaccines are given in 2 injections and an oral vaccine. At other places in the country, there are different types of combination vaccines, so that may look slightly different. But in general, those are the types of vaccines that are recommended at the 2-month visit. And again, so just since we're talking about consequences of vaccines in terms of what the parents might see, what I always tell parents in my office is, first and foremost, you might get a local reaction, meaning that the infant may have a little bit of redness or swelling in their legs around where they get the shot, maybe a small rash that should resolve within a week, if not within just a couple of days. Sometimes there'll even be a little bit of a bump underneath the skin that seems to last a little bit longer, but again, that's nothing dangerous. And then the next level would be any sort of systemic reaction. So as we mentioned, fever is possible. Any temperature 100.4 or higher is considered a fever. And again, it's not that number is dangerous or that the fever is dangerous. It's just the body's way of taking up the vaccines and building an immune response to it. So again, this is all about teaching and trying to provide education for families. So to say, these things might happen. These are the things that you can do if they do happen, but these are the consequences of doing those things that you may choose to do. So, one thing does interact with the other.
So among pediatricians and maybe the American Academy of Pediatricians, what diseases give the most concern?
That's a little bit of an interesting question, I guess, in terms of what you really mean by that. What are the most dangerous diseases, or what are we seeing more? I think both that can be a different those can be two different things. So I think any disease that is covered by a vaccine can be dangerous. It can potentially hospitalize children. There can be deaths from most of these illnesses that we vaccinate against. But I would say the biggest things that we're seeing around the country that I think are really important things to vaccinate against, and particularly here in Maine, at this time of year, flu is definitely an important thing to vaccinate against. And there's a lot of controversy around the flu vaccine. My opinion about why there's a lot of controversy is that we give the flu vaccine to adults, and adults have more opinions than kids do. So that seems to have, people have a lot of things to say about the flu vaccine. But what I would say is that this time of year, the flu is very important to vaccinate against because people die from flu every year. So that's in the news all the time. Thousands of people die every year. And you have a choice to try to do something that prevents that. Now, is the vaccine that we have 100% effective? Are any of the vaccines that we have 100% effective? No, not at all, unfortunately. But it's the best thing that we have to prevent illness. So even with a flu vaccine that seems to be not the perfect vaccine for the season, it's still going to provide coverage and eliminate illness for a lot of people. So right now that's important. The other thing that's also really important here in Maine is pertussis. So we've seen many, many, many more cases of pertussis throughout the country, but definitely here in Maine and in our community here in York County, that's also certainly true. So I would say that that's really important. It can be particularly bad for infants, and they do get vaccinated for pertussis, but they're the ones that usually end up in the hospital. The older kids also get pertussis, and they're kind of a lot of times these 8, 9, 10-year-olds are the kids that some of their vaccines have worn off at that point in time, and they start to carry and they start to spread the pertussis illness. Pertussis is also known as whooping cough, so that's the other name for it.
So what are some of the symptoms of whooping cough?
It's one of the illnesses that can be pretty difficult to diagnose, unfortunately, because a lot of times in the early stages, it just looks like a cold. So kids cough, runny nose. Doesn't usually necessarily come with a fever, but any illness can come with a fever. And it's just this kind of persistent cough. It's the much, much, much later stages of pertussis where the name whooping cough comes from, where people take in this really deep breath of air because they can't catch their breath after coughing so much, and then the whoop is actually this inspiration that they take after they've had a very persistent coughing effort. So that piece, you don't always see that, so you have to try to just be suspicious of kids at, like I said, somewhat of a certain age, or if they've had an exposure. A lot of times parents will come in and say, I got a note from school that there's a case of pertussis here, so I'm concerned about it. My child does have a cough. Or, this child at home has been diagnosed with pertussis. What do we do about my other kids at home? What do we do about grandparents? All of those different types of things. So I would say that those are the big two right here that people should really think about.
Now, if you suspect pertussis in a child, is there a test for that?
We can. There's a test for pertussis, but if we're testing for pertussis, we're treating for pertussis. Because if we are suspicious enough to test for it, we should be treating it, because the biggest other risk is that they're going to spread it to other people. And the antibiotic that we use to treat pertussis, really the best thing about the antibiotic is, yes, it will help the patient, but it decreases the spread of the illness, and that's really the most important thing. So that's what's hard sometimes for pediatricians, is just balancing that, like, okay, is this a regular cough and cold, or am I suspicious enough here of this child that I think we need to test and treat?
So just to summarize, what diseases here in Maine have been eliminated basically by the use of vaccinations? I
would go back to polio again, which I think in Maine, you can still see people who had polio as a child and still have some of the repercussions from that. So having them in our communities actually is a benefit to promoting the vaccine. So that's definitely a dangerous illness, but really one that we don't see very much anymore. We don't really see very much diphtheria or tetanus. Again, with vaccination rates, that we see that. Measles, I think, can be a very serious illness that is very important, and we're seeing different different outbreaks of that around the country, because that is one that people seem to be skipping or delaying vaccination for. So that comes with a rash, it comes with a cough, it comes with conjunctivitis, it comes with a fever, and often those children end up in the hospital. With measles, that can cause encephalitis, which is swelling of the brain, and that can be very serious, obviously, and come with, if the child does recover from that, there can be serious consequences, long-term consequences from that. But again, of course, unfortunately, some people don't recover from that.
Can you give us an example of a personal experience you may have had with a parent who was very adamant about not vaccinating their child?
I've had several different encounters with parents who come in, usually with their infants, and are feeling put off by vaccines. And I think most recently I can think of a mom who came in, and I think may even have been in the healthcare field herself to some extent, and was concerned about vaccines and wasn't sure if she was going to vaccinate her child and was somewhat hesitant about them. So she came in the infant came in as a newborn. And so we had a few visits to talk about them before we got to that 2-month visit that I talked about earlier, where there were a little bit more vaccines that the infant was going to get. So over those visits up until that point in time, which was maybe 2 or 3 visits, we were able to have a conversation. So we talked through what are the risks of the vaccines, as we've talked about here today, what are the benefits of them, that these illnesses basically are still out there and they still are pervasive in different areas of the world. So it's best to just protect your child against them, because any outcome from the disease is going to be worse than anything that could happen with the vaccine. So that's also a point that I process with parents. I also have a lot of very good handouts in my office from the Children's Hospital of Philadelphia, which is also a really great resource for vaccine information, that talks about, again, components of vaccine, why it's important to vaccinate, how many vaccines can your child tolerate at one point in time. So I think that's another concern of parents. And so over those visits and time, she started to say, okay, I do think that this is something that's important. I'm not as nervous about them. I'm not as scared about them. I think she's still, when we did get to the point of doing all of the vaccines on the recommended schedule, she, was emotionally upset at the visit, just again with her child getting poked, like most parents are, just a little bit tearful. But then when they came back after that visit for their next visit, she said, nope, didn't have any problems. He was a little bit sleepy, but no fever, no excessive fussiness. So that's also a really positive thing for me. It's always nice when parents do have a good experience with the vaccines, meaning afterwards that they don't see any side effects and the child hasn't gotten a fever or anything like that, because that means most of the time that the parent will continue to vaccinate. And this mom, I think, has some concerns maybe later on with some of the vaccines as the child gets older. She may not want some of those. I think she's expressed concern already about the chickenpox vaccine. But in general, she's vaccinating on time and on the recommended schedule. So for both of us, that helps with our rapport with one another too.
So it's not just important for the individual child, but for the greater community as well.
Exactly. So as I mentioned a little bit earlier on, we have children in our schools these days who have multiple different diseases. They may be on chemotherapy for treatment of cancer or treatment of other rheumatologic issues. And these children are really children at risk for a lot of these illnesses, not because they haven't been vaccinated themselves, but they're on immunosuppressant medication. So their immune systems are not working as well as other children's immune systems at that point in time. We also have children in our community with very rare immunologic disorders where their immune systems may not work at all. And then we also have children who had anaphylactic reactions rarely to certain vaccines, so again, can't be vaccinated against certain things. So those families rely on all of the other families and all of the other children in the school to protect their children by being vaccinated themselves.
So for our local community around here at Southern Maine Healthcare, how can you reassure people that we're on top of the issue of vaccinations?
So I think that what's most important is to realize that pediatricians are here to care for families and children, and we only want the best for your children. So we tend to be the experts on all children. You're the expert on your own child. So come in and have a conversation with us about your concerns, express your concerns over vaccines, and realize that we want to give you the best information and the best education that we can, that we don't have any ulterior motives other than to try to protect our communities, to try to protect our children and keep our children healthy and safe as much as possible. So come in and have a conversation, express your concerns, because we want people to have input into the decision making about their children's health and their family's health.
Well, we've run out of time for this week. My guest today has been Dr. Margaret Bordeaux, a pediatrician at SMHC Pediatrics. Dr. Bordeaux, thank you for sharing some time with us.
Thank you so much for having me.
If you would like to learn more about childhood vaccinations, you can visit vaxmainkids.org. That's spelled VAXMAINE kids.org. You can also log on to the website for the American Academy of Pediatrics at AAP.org. Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities. Brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.